So I really do wish I would have attended TCT in person, but I just couldn't. But I do know that there was some excellent data that was presented with regards to, novel CAR T cell therapy constructs that are continue to be evaluated in various subtypes of B cell lymphomas. So one of them would be the CD19, CD20 construct. Then there was the CAR NK therapy that was presented. Natalie Grover presented the CCR4 expressing CD30 CARs in relapse refractory Hodgkin, which I do believe is an unmet need because, historically patients with Hodgkin lymphoma, about 85% of them can be cured, but the ones who are refractory to treatment, they seldom have great choices. And I think at this point in time, that does remain the unmet need. So patients who do relapse after frontline treatment with Hodgkin, and if they do not respond to brentuximab or a PD-1 inhibitor, these are the patients who are really in need of new options. I think Natalie Grover and her group previously had presented CD30 CAR T data in Hodgkin lymphoma, which looked good. However, the responses did not have long-lasting effects as a result. The CCR4 expressing CD30 construct, certainly right now, albeit the number is small, looks very promising. Besides that, there was the 2-year follow-up of the Transcend study, which explored lisocabtagene maraleucel in the third-line setting for patients with relapsed refractory aggressive B-cell lymphoma. And that data that was presented by Dr. John Arneson did show that the molecule continues to be highly efficacious, as well as safe, as well as durable. So I think these were my takeaways from TCT with regards to CAR T cell therapy. And then I also looked at some of the, the trends that were presented from the CIBMTR data, the European data, and it was interesting to see how there has been a general decline in the utilization of autotransplant, and there has been an uptrend in the utilization of CAR T cell therapy, and not just in the US, but also in the European Union. So I think worldwide, there are things that are happening that are good for our patients. And it was nice to see those data be shown at the TCT conference.